Can start the recording. Good evening, everyone, and I want to welcome you to our educational seminar on getting healthy and feeling great. We're so excited that you're here to join us. I'd like to introduce myself. My name is Cheryl Wilson. I'm a former educator, and I currently work with health professionals implementing customized wellness solutions into their practice. I am very excited and passionate about wellness, and again, I'm so happy that you're here to join us. So, what are we going to be learning tonight? Our goal is to educate you on some things that you should eliminate from your diet, as well as some things that are going to be beneficial to add. I'm going to highly recommend that you write some things down as we go through this tonight, because you are going to get a lot of great information that's going to be useful for you and your family. So I want you to think about something. What one thing would you like to change about your health if you could? Kind of keep that in your mind as we go through this evening, because I guarantee you're going to hear something pertaining to that as we go through this talk. So let's talk about how healthy we are right now in the United States. As you can see, we are #1 in the world for heart disease, diabetes, obesity, and osteoporosis. Autism increased 600% in the last 4 years. And 70% of Americans, guys, either have high blood pressure or pre-hypertension, meaning that they are ready to end up having high blood pressure. And more than 67% of Americans are overweight or obese. You know, when you look at these kind of statistics, you realize that as Americans, we're actually getting sicker and unhealthier as each year goes by. Now, what can we do to actually support our daily wellness? Well, we should be eating 10 to 12 servings of fresh vegetables daily. We should be eating 2 to 3 servings of fresh fruit daily. We should be exercising, drinking lots of clean water, getting enough sleep, and reading the labels that are on our packaged foods, making sure we're not getting those toxic ingredients. But let's take a look at the reality. What are most people actually eating? Well, here's a nice photo for you. You can see most people are living at fast food restaurants. You can see pictures of our kids where they're consuming soda and junk food, and we're all living on sugar and Red Bulls and energy and caffeine. There is so many things that we're putting into our diet that don't fit with all of those criteria that I just read to you. So what do our foods actually contain? If you take a look at these, and these are especially things I want you to remember after tonight's talk. We have so much hydrogenated oil, which you've heard of as trans fats, in our foods. Now, what do these things do? They clog your arteries. They increase your insulin resistance, and they're linked to heart disease, stroke, diabetes, and so much more. You're going to find these hydrogenated oils in things like your peanut butter, the crackers, breads. You'll even find it in those little dairy containers which have the milk that sits on the table that we put often into our coffee. You've got to read the labels. Now, a lot of people are consuming artificial sweeteners like aspartame. These are lethal neurotoxins, and they're known carcinogens. Look at what artificial sweeteners are also doing. They're raising your risk of diabetes. Also, heart disease, Alzheimer's. They actually cause you to gain weight and fat. They stimulate your appetite, and they increase your cravings for carbs. So using artificial sweeteners is actually one of the worst things that you can do for yourself. And if you think about the diet sodas, you look at people who are consuming those regularly. Believe me, there aren't people that are losing the weight and fat like they want to. You often see people with very large weight gain when they're using a lot of the diet products and these artificial sweeteners. We also have a lot of the aluminum-lake food coloring in our food. As you can see here, many of those are contaminated with cancer-causing substances, and the ones you really want to be very, very careful of, as you see at a red, those are linked to so many adverse health effects. high fructose corn syrup, also associated with a lot of negative health effects like metabolic syndrome, triglyceride levels that are elevated, hypertension, fatty liver disease, even gout, and so many other things. And monosodium glutamate, which is MSG, it's actually been linked to brain lesions that mimic MS. It's a major causer of migraines, Alzheimer's, obesity, autism, and so much more. And something I want you to remember as we go through these slides. Hidden names for MSG can be hydrolyzed vegetable protein, cornstarch, gelatin, pre-gelatinized, and so on, because you're going to see those show up in a few slides. So now, let me see if I can send this forward. There we go. Let's talk about how much sugar we're eating. Evidence has been mounting that sugar is actually the major factor causing obesity and chronic disease. And all of the sugar that we're taking in has been linked to our fat gain, depression, autoimmune diseases, higher stress, lower energy, Alzheimer's, and especially cholesterol. If you're concerned about cholesterol levels, you definitely want to be cutting back on the sugars. Now, according to the American Heart Association, men should be eating a maximum added amount of sugar of only 9 teaspoons, women 6, children only 3, and the average child is consuming 21 to 35 teaspoons a day. Now, I used to work in the school system. I can tell you our kids are consuming way over that amount. All of the different things that they're eating are just adding and adding and adding to the sugar. Now, because I used to teach math, here's what I want you to remember. When you read a label, 4 grams of sugar on a label is equal to a full teaspoon of sugar. So this is how you're going to translate. When you look at the number of grams of sugar on a label, you're going to divide it by 4, and that's going to give you the number of teaspoons. So now let's look at an actual label. So many people drink orange juice. They'll start their morning off with it. They think that they're doing something that's very good for them. So let's take a look at how much sugar is in an average small bottle of orange juice. This orange juice bottle is about 16 ounces. That's only 2 cups. So it's one of those kind of small bottles that you would find in the vending machines or in some of the grocery stores. Now, if you look at the label, look all the way down until you see sugars. There are actually 34 grams of sugar right here. Now, if I take that 34 grams and I divide it by 4, that's going to be about 8.5 teaspoons of sugar. The only problem is when you come back up on the label, there are 2 servings in this one bottle. That's 17 teaspoons of sugar in that one little bottle of orange juice. You are throwing yourself off, and if you remember from the previous page, you're not supposed to be doing anywhere near that amount even in a full day. So it's going to be very important for you to be reading that on labels. Now, what are better choices to sweeten? Raw unprocessed sugar or raw honey is a much better choice than just regular sugar. However, it is still sugar, so you need to realize that and use those very, very limited. Stevia is actually your very best choice. This is an herb that's been around literally for hundreds of years, no known side effects, does not affect your blood sugar. You can even bake with it. Also, stevia is so sweet, you only need very, very small amounts of it. Now, xylitol is another natural sweetener. It's actually a sugar alcohol that is plant-derived. The one thing about xylitol is it tastes almost exactly like sugar, but because it's a sugar alcohol, you don't want to be using large quantities of it. Also, you should not be baking with xylitol. Okay, so just so you know those 2, but those are your best options. Stevia is number 1. Also, salts are very good for you because you do need healthy sodium and you need the minerals that we find in salts. The Himalayan salt, the sea salt, and the Celtic salts are much better choices for the salt that you're going to be using. Now let's talk about, should we take supplements? Well, why might we need supplements? Number 1, we're not getting the nutrients from our foods because the soil has been depleted, excuse me, and We're not making such great choices in our diet. So many people, and our kids especially, are living on fast food. We're also getting a lot of those preservatives and chemicals in our processed foods. We're supposed to be eating 2 to 3 fruits and 9 to 12 vegetables every day. The reality is we're not even coming close to that. And studies show 90% of all Americans are actually deficient in their essential nutrients. So we do need to be making good choices when it comes to supplementation, and we definitely need them. Now, here is something that's very important. Prescription drugs actually deplete the nutrients in our body. What I did is I just took and printed out this one part of what is on a great handout. Please email the person who invited you to be on this webinar to actually get this handout. They can send this to you. But so many people have taken aspirin or ibuprofen or any of those things thinking, you know what, that's not a bad choice, it's over the counter. But take a look on the left what aspirin and ibuprofen all actually deplete out of your body. You can see vitamin C, you can see vitamin D, you can see a lot of the Bs, even iron taken out of your body. Because when we take any type of prescription drugs, whether over the counter or from our physician, they actually do go in and operate with those vitamins within the body and deplete them. Now, what are the results of all of those things being depleted? If you don't put them back, you increase your risk of heart disease, you have a depressed immune system, you're increasing your risk of osteoporosis, even birth defects, and anemia. So understand, every time you do put any type of drug in your body, there are going to be side effects to that unless you put those vitamins back in. Now, the American Medical Association now recommends every adult should be taking a multivitamin daily because they see what's happening with the food that people are eating and the amount of depletion that is happening. Also, the American Heart Association recommends everyone take 1,500 milligrams of EPA and DHA fish oil daily. Please be sure your fish oil is tested for toxins. You don't want to be consuming all of those chemicals and mercury that we find in our fish oils. Now, what happens is people understand this. We see this on the TV programs and in the news. As far as supplements go, almost everyone is taking a supplement. But here's the problem. People go to the store and go, oh, well, they're all the same. I'll just pick one out. You cannot assume that any supplement you find on the grocery store shelf is going to be safe for you or your children. So we're going to take a look at a couple of very popular supplements and their labels. Centrum is one of the biggest selling vitamin lines in the world. But what I want you to look at what's highlighted in the yellow. You can see all the aluminum lake food coloring. Now, we've already discussed how toxic that is for your body. Hydrogenated oil, which is, there's your trans fats, again, related to heart disease and all. Polyethylene glycol found in antifreeze. Talc, which actually was taken out of our powders years ago because it's been linked to lung cancer, just like asbestos. But now here's a few things not highlighted. Pre-gelatinized cornstarch and gelatin are very often hidden names for MSG. So you're seeing that there are many, many ingredients in this supplement that are not going to be adding to your health. Now, number one selling children's vitamin is Flintstones. Here is Flintstones complete with vitamin D for your child to be healthy. Notice the artificial flavors, hydrogenated oil, aspartame, there's your artificial sweetener. All of these aluminum lake food colorings, and if you come back in, look at the pre-gelatinized starch, gelatin, and cornstarch. Again, ingredients that are not going to be enhancing the health of your child. Now, here's an actual x-ray that was done. When you take any food or pills or anything else in, the job of the stomach is to bring in acid and break it down. If it escapes out of the stomach undigested, there is no other organ that will actually digest it on its trip out of your body. So if you were to take a Centrum Silver, which you can see right here in this label by this doctor, that should have broken down in the stomach. What happened is this: the day of the x-ray, you can see this right here, this is a completely undigested Centrum Silver that is already now traveling through the colon. Here is another one which was taken the day before the x-ray. It's still just traveling around in the body. And here, this one, which is in the rectum and about to make its escape, was taken 2 days before the x-ray and is going to end up leaving the body undigested. So what's important to remember, it's not necessarily what you take, it is what you absorb that is important. If you're going to be taking supplements, it's very important that they actually absorb in your body. Now you can see here, and I'm going to ask this question, would it be beneficial for you to find a safe, simple, and absorbable way to be able to supply your body with up to 80% of its nutrients needed on a daily basis to function optimally? I mean, that's an easy answer. Of course it would. So what we're going to do is walk you through some of the products that we're actually using in the physician's office as well, and they're making a big difference in the health of their patients. These vitamins are actually in what's called an isotonic form. They come in a crystalline powder. You mix them with an exact amount of water, and these supplements are taken on an empty stomach. Now, people often say, oh, I always get nauseous when I take pills and other things. Well, yes, because often they don't break down. But with this, the stomach receives it like it would a body fluid. Therefore, no digestion needs to take place. The stomach just releases it very simply. It goes into the small intestine, and it is up to 95% absorbed in only 8 to 10 minutes. Guys, that's huge. So a product that has very high absorbability is going to have great results within your body. Now, to show you how simple it is to do this, each of these bottles actually comes with a little cup, and you can see it outlined in kind of the red on the side. This is the cup that sits here on top of the bottle. 2 ounces of water is where you fill it, and then the little screw-on cap is what you put the powder in. When you mix these together, they're going to effervesce for a few seconds, and then you drink them down, and again, you're going to end up with that 95, up to 95% absorption in only that 8 to 10 minutes. So let's walk you through some of the supplements, again, that we're using in the medical offices. We have a highly absorbable multivitamin with minerals. This comes with or without iron. And the great thing is that this has exceeding 100% of the daily value for the important nutrients that you need, but it also has the minerals. A multivitamin without minerals cannot operate properly because you need the minerals in order to absorb the vitamins. We also have prenatal multivitamins, which are phenomenal, helping contribute to that healthy pregnancy, normal blood pressure, healthy birth weight for the baby. It's been wonderful for moms. In fact, I in particular know a mom who was having a lot of issues with nausea in the morning sickness. She started taking this prenatal. It made a huge difference for her. We have a children's line of supplements as well. If you're on this webinar tonight and you have kids, please talk with the person that invited you. We have an entire line of natural supplements that help address the autistic spectrum disorders for children. Many parents are looking for natural alternatives. We have them right here, so definitely get with that person and ask them. We also have B complex. What's great about Bs? You need them to decrease your stress, increase your energy, and almost everybody will tell you that they have too much stress and not enough energy. This is also a metabolically activated form of B, meaning It's going to absorb in your body and you will feel results from it. And by the way, this is not just B12, it is all of the Bs. We have a super antioxidant called OPC3. This is an all-natural anti-inflammatory that helps support healthy cholesterol, circulation, joint flexibility, your heart health, even blood glucose levels, platelet activity, even your eyes, and this is all that's in that product. There's grapeseed extract, the pine bark, red wine, bilberry, and citrus. This is a whole food supplement that has had amazing results, and this product has been around for close to 20 years. This is not a new product, but with this delivery system, it's in your body so quickly you can have tremendous results with inflammation. There's even 3 medical studies. I'm showing you just one of them. This shows more than 50% decrease in C-reactive protein. What that means is it's showing more than a 50% decrease in inflammation because C-reactive protein is a marker for inflammation in the body. Now here's an actual patient. Dr. Savadakis is a wound care specialist and podiatrist in the Tampa area, Florida. And his patient, 65 years old, more than 30 years of psoriasis with plaques all over her body. She has been unresponsive. He is a doctor that works with Nutrimetrics. Therefore, he tried her on the anti-inflammatory. Now, you saw that little cap with powder. Because she looks very puffy, if you look at her feet, they look very inflamed. He started her on 4 of those little caps per day, probably 2 in the morning and 2 in the evening. Look at the results. This patient, after only 2 weeks, more than a 75% improvement. He continued to keep her on the OPC3. Here is what her feet look like after 6 weeks. She is not cured. Her body is going to produce inflammation in this way, but what he found, and it would be with trial and error, that's how simple it is to work with these, she now maintains this with only 2 caps per day. So she most likely does 1 in the morning and 1 in the evening. Here is the start and the finish for this patient in only 6 weeks' time. This is a great visual because it's, you know, pain is subjective, but when you can look at someone with a tremendous result visually, you see that this product is very, very effective. Now, what you see here is a list. These health challenges we've actually seen supported in the health practice. Now, always remember that everyone is different, but because all of these particular health challenges have inflammation in common, we've seen a lot of great results with arthritis, back pain, body pain, and knee pain because that's inflammation. Asthma's inflammation of the bronchial. Allergies are inflammation of the sinuses. ADD and ADHD, we've had some great results with this. We've had a number of children and adults be able to get off their pharmaceuticals that they were taking. Helps with joint stiffness, autoimmune like fibromyalgia and MS. Helps support blood sugar, gout, migraines, neuropathies, and any other issues that are tied to inflammation. So think about someone that you may know who would be looking for a natural solution to an inflammatory issue. We also have a calcium. This calcium is ionized, meaning it is extremely absorbable. And it's been wonderful to support, obviously, bone health, but it also helps, as you can see, with teeth and gums, with your heart, with hormone secretion, immunity, and so much more. But what's been great is when people do a cap of this at bedtime, it actually helps them sleep better, more restful. And I've actually seen this in some of the medical practices. We've had patients who have had restless leg syndrome, who have had very, very good results with this calcium, and some have even been able to get off their pharmaceutical with their physician's help. Now, all of these products actually come in a daily essential kit. Again, the person that invited you to the webinar can get you more information, but understand how affordable this is. You can literally take all 4 of these products, meaning the multivitamin, the B complex, the super anti-inflammatory, and the calcium for only about $1.50 a day. You know, think most people go out and buy a Red Bull and spend way more than that. And these products are actually going to give you a tremendous baseline for your daily essential needs. We also have packets for convenience. This packet actually has all 4 of those supplements already in the packet. You just tear it open, add 8 ounces of water, and drink. Simplified wellness. Very, very easy, and it runs a little over $2 per day. So very effective and simple solutions. And I guarantee if you're on this webinar tonight, you know someone who is stressed. This product is an all-natural tablet support, helps with anxiety, stress, depression, and much more. Starts to work in only 10 to 15 minutes, and the great thing is it is non-drowsy, and it increases your mental focus. So many things that people take for anxiety and depression and all actually makes them very tired and lethargic. This does the absolute opposite. It just sharpens your brain, helps you function well, and again, non-habit forming. So these are something you would take only if needed. And if you know anyone with digestive issues, we have a full line of product to help support issues like acid reflux and GERD and regularity and so on. These are tremendous products, and they've made a huge difference for so many people. Also know there's a complete line of supplements. We can address any health concerns. Again, just speak with the person who invited you, and they can get you more information on that. And the last thing I want to cover is asking if you know anyone who may be ready to lose fat, pounds, and inches, but this time be able to keep them off. We have a very simple and effective 30-day Fat Blaster program. This program is easy to do. It's going to support you with what you need, and it's going to teach you how to eat for a lifetime. Benefits. You're going to lose weight, fat, and inches. You're going to boost your metabolism. How many of you on this webinar tonight see your metabolism actually slowing down every year? It's going to help you curb those food cravings, increase your energy. It's going to help support the anti-inflammation, healthy blood sugar levels, and it's going to help you feel and look great. And again, this is a program that you can follow for a lifetime. What it includes: personal coaching. You get one-on-one support for your success. A complete program guide with foods list, exercise suggestions, and much more. It's going to be based on what we call low glycemic eating. This helps your body process the foods properly and not throw you into fat storage. You're actually going to be in fat burning mode. Eating for a lifetime, no counting calories or points, and you're shopping from the grocery store, so again, you can maintain this. Now, these are typical meals that you're able to prepare when you're eating low glycemic. You can see all the proteins and vegetables and black beans and eggs and shakes and sweet potato and so on. The list is huge on the foods that you can eat and support your body to do what it needs to do appropriately. What else does it include? Natural tablet supplements. Now, our tablets are food-coded, meaning they break down in 10 to 15 minutes. You get a fat and carbohydrate inhibitor. Clinical studies show this helps you lose weight and fat, supports your blood sugar, your insulin, and your cholesterol. And look at the middle. Those are the ingredients. It's white kidney bean extract, green tea extract, chromium and leptocore, which is a clinically studied natural ingredient that helps support stress hormones. And guess what? It's going to target belly fat and love handles, something we all so enjoy. Also, green coffee extract with Garcinia cambogia, There are therapeutic levels of green coffee and the Garcinia cambogia in this product. This is so important. This is going to help stop the conversion of the sugar into fat, but the best thing about this product is it helps to use your stored fat as energy. There's also no caffeine. It's going to support your blood sugar levels, blood pressure levels, serotonin, which is that feeling of well-being, and much more. You get complete greens. Why? Because you need to get your vegetable servings in, and the reality is we're not eating enough vegetables. These can be in tablet or powder form, but 1 little teaspoon is equivalent to 10 green vegetable servings. There's protein and fiber shakes that actually taste good, and you get an entire box of those daily essential packets that I just showed you a few slides ago, which are going to contain the anti-inflammatory, the B, the multivitamin, and the calcium. So now you're supporting your daily health. You can see here, this is Jen, who has lost 20 pounds and 16% body fat following this plan of eating appropriately and the supplementation. This is Laura, who's lost 32 pounds in 12 weeks. That's 14.5 inches that she has lost, and in the center picture, you can see how much she has lost from her waist alone. This program is only $269. The regular retail is $400. You actually save $131 with this. And if you go out and price programs on the market, this is a fraction of what the weight loss places are charging. And here you get that personal coaching, the program guide with your food list, the exercise, and then all of the supplements that we just went through. Guys, this is a very simple system. We guide you through it, and you're going to eat a lot of food, because the more appropriate foods you eat, the more weight you actually lose. We also have a month 2 and a month 3 program available for those people that want to continue. And if you have reached your goals after month 1, then we can help you to be a maintenance program, which is going to be basically following the same type of eating. So it's tremendous. So I want to thank each of you for joining us this evening, because nothing is more valuable than your health. As a next step, please contact the person who invited you to watch this webinar to get your questions answered. And please let them know if you would like to order any of the products that I went through this evening, they can get those for you. Now, I am going to just give you my email. You are welcome to email and ask any questions, but please go back to the person that invited you to the webinar if you have any other questions. And I want to thank everyone for joining us this evening. We so appreciate your time, and again, your health is your most important asset. Good evening.